This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask, we have the answers. This week, our episode is titled, How Lifestyle Can Impact Male Fertility. I'm Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. What's up, Justin?
Hey, Kev. Hope you had a good weekend. We're recording this on a Monday. I'm excited for today's topic. I think this is one of the big ones that it's important for two reasons, right? And one is we don't talk about it enough.
Right.
And then two is people are scared to talk about
Absolutely.
it, I think. And especially guys, right, Kev?
Yeah, I mean, this is, infertility is an issue that's stressful for couples, right? It's a stressful thing. It's stressful on both the male and the female in the relationship. But, I think a lot of people out there don't know is that the male can play a big factor in infertility, right, Justin?
Absolutely. Correct. I mean, so infertility affects approximately 15% of couples that are trying to conceive. And when we're talking about male factor infertility specifically, it takes two to tango. And some people are surprised by this number, but, male factor infertility is involved in about 50% of cases, right? You have a man, you have a woman, you need both. And when you're looking solely at how often, the male factor aspect is the only thing that's responsible, we're talking about 20 to 30% of cases. Now, I feel like that's something people don't know, right?
Exactly, Justin. 20, 30% solely. I think, traditionally everyone's kind of thought that it's like, oh, it's probably something going with the female. But look, 20, 30% of the time, it's solely the male. So I think this is something that needs to be talked about. And I think it's a lot that guys who are, if they're in those years of their reproductive years, that they kind of want to know about.
Yeah. And that's what we're going to learn about today. And that's why I'm very excited to welcome on one of our guests, Dr. Josh Halpern. He's one of my mentors over at Northwestern. He's the assistant professor of urology at Northwestern Medicine, specializes in men's health, more specifically male infertility and sexual medicine. Dr. Halpern, thanks for joining us.
Hey, thanks, guys. Awesome to be here. Great to see you guys and talk about this important topic. Obviously, as if I don't get to see Justin enough, we get to record this after hours. So I'm glad to get this bonus time. But really, but it's a pleasure to be here. Love what you guys are doing with the podcast, and excited to talk about this topic. And like you guys said, super important topic that I think is near and dear to all of our hearts.
That's, I think you're the perfect person to talk about this topic. So let's just jump right in. All right. So Justin gave us some numbers about male infertility. Obviously, there are many couples that struggle with family planning, and yet we know many times men are not evaluated for their fertility. Why do you think that is?
Well, I think you guys kind of hit the nail on the head right from the get-go. One of the big issues, I think, is that a lot of couples don't realize that male factor infertility is so prevalent. So we know that, like you guys said, about half the time there's going to be a male factor when it comes to couples that are struggling with fertility. And I think, we've done a really good job, or increasingly better job, kind of raising awareness about infertility in general. But I think the thing we've not done a really good job of is letting guys know that kind of the male is implicated a lot more than we tend to think. I think kind of, in the lay press, there tends to be this emphasis of infertility as a disease of women, but it's just not the case. So I think that's a big part of it. I think that the other thing is that guys just don't like going to the doctor, right? We know that guys, especially young guys, which is, typically the age when men are thinking about building their family, they hate going to the doctor. In fact, our group has done some research and looked at this, and we found that about 1 in 3 guys who is coming to see us for infertility doesn't even have a primary care doctor. So, there's not even somebody that they're kind of connected to really kind of have that conversation to help them learn a little bit about what's going on. Whereas, women, we know typically they have an established OBGYN doctor. They see a gynecologist regularly for a checkup. And so that's kind of the natural place for them to go. Guys just don't have that. And then, I think the last part, unfortunately, is I think there is a little bit of stigma when it comes to male infertility. I think it's hard for guys to talk about this, even more so than it is for a lot of women. I think a lot of times, there can be guilt associated with feeling like maybe, the fertility not working out thus far is, someone's fault. And I think guys have a lot of trouble thinking of it that way. So I think all these things together it makes it really hard for guys to even take that first step to get evaluated, which we know is so important for kind of getting the treatment that they need.
I think you bring up some excellent points there. And one thing I think it's so funny is maybe this is the cusp of where we were with erectile dysfunction before all the Cialis and the Viagra came out, because no one wanted to talk about their penis problems at all. And now we're focusing now more on ball problems here with fertility. But once we were able to kind of get that message across, we got people coming up to you on the streets saying, I take Viagra and Cialis. Yeah. So we really have to make this progress in this department. And I've talked with a lot of women who, once they found out that they didn't have to bear this sense of, responsibility, once they found out that also men can contribute to infertility, I think it goes a lot both ways in informing people. And if we can even inform the men as well as the women, I think that also helps get these people into the door. And it's just kind of like getting it out there. And that's what we're trying to do here today.
Normalizing it, right? Normalizing it. It's something that can be part of the everyday conversation. And, so yeah, exactly why, Justin, what you said, that's what we're here for today, and why we have the best help with Dr. Halpern to educate our listeners.
Yeah. And this kind of leads into the next question, right? Like, so we talk about people not getting evaluated for fertility, but who should be seeking evaluation for fertility? And at what point should a guy consider getting worked up?
Yeah, I mean, that's a great question. And I think that's a really great place to start. There are all sorts of guidelines out there from kind of our professional societies to try to help us figure this out. The conventional wisdom and what most guidelines agree on is that when couples have been trying for a year, unprotected intercourse, trying to get pregnant, and have not yet succeeded, that is definitely the time you want to get evaluated. That's when you want to see both the female fertility specialist and the male fertility specialist at the same time. You don't want to wait for one to come back and then kind of do the other one. Pretty strong evidence that we should be doing this in parallel. So when you hit that 1 year mark, you kind of both want to get checked out. But 1 year is kind of the limit. That doesn't mean that you can't get evaluated sooner than that. And there are definitely going to be some couples that are going to want to get in sooner. A lot of different scenarios where that might be the case. For example, we know that couples where the female partner is a little bit older, maybe the chance of getting pregnant naturally is a little bit lower. So, that number sometimes is thrown out as 35, but there's no perfect number. That couple probably wants to get in a little bit sooner, sometimes around the 6-month mark. If you've got any signs or kind of any history where you think, fertility might be an issue for us, for example, a guy who's had, let's say, testicular cancer, has had some chemotherapy and is thinking, we may be in for a little bit of a hurdle. Those are the kind of guys that probably want to get in a little bit sooner just to be proactive about kind of getting ahead of the 8 ball, so to speak.
So, Dr. Halpern, just to go back, you touched on it. You said infertility, basically couples having unprotected sexual intercourse over the course of a year. How often should couples who are planning to have kids have sex during this time period?
Yeah, so this is a question we get all the time because, a lot of couples, they've been together for a long time or they haven't, whatever the case may be. When they're ready to start trying, they are ready to go kind of full steam ahead. We get guys coming in, they are having
balls
sex
to the wall, baby.
3 to 4 times a day around the ovulatory window. They are not messing around. And the truth is that that's really not necessary. If you want to go ahead and do that, then, God bless. But, what the evidence would suggest is that number one, you might wear yourself out. Although again, if not, then you're in pretty good shape. But
no, just to interrupt you there, because I totally agree with that. Right? I think a lot of the problems we see are sexual dysfunction. It's not even that they have issues with their semen parameters are actually fine. They come in because they're saying, Doc, when she's ovulating, we're having sex 4 times a day for like 5 days straight. I'm exhausted. I can't keep an erection. Mm-hmm. I'm stressed out. Mm-hmm. And so, I mean, that's a huge part of this. And I think that, there's such a huge mental component because for many people, it takes the fun out of having sex. So this is an important thing, right? This kind of timing thing, exactly what you're saying.
Yeah, I mean, totally couldn't agree more. We see so much sexual dysfunction in guys who are trying to get pregnant. There's all sorts of reasons for that. I think Justin hit the nail on the head again. I mean, it's just stressful trying to get pregnant in the first place. We know that stress can have an impact on your sexual function. That goes without saying. We know that that guys are trying to have sex very frequently, and we'll talk, a little bit of a detour here, but we'll kind of get back to that one for sure. So that definitely feeds into it in a really significant way. That certainly is something we see a lot of. We may kind of circle back to this and talk about ways that we might be able to help with that. And I think the thing that you said probably puts it best, which is that you're taking something that used to be fun, it used to be spontaneous, it used to be the thing that you kind of just let materialize in an organic way, and all of a sudden it's like business. Pee on the ovulation strip. Yeah. Hey, we got to get over there. We got 10 minutes. Let's get the job done. And it's really hard to perform on the spot like that. And a lot of guys struggle a lot with that, and no surprise that they do. And the reason why it's not necessary is because we know there's pretty decent evidence that if you have sex, between 1 and 2, every 1 or 2 days around the ovulatory window, that's probably going to be your best bet. So a lot of guys think more is better. Not necessarily the case. If you're going every other day, maybe every day gives you a slight advantage, but that's really going to be the way you optimize your chance of getting pregnant. If you're having sex more than that and it's wearing you out, then you're definitely taking 1 step forward, 2 steps backwards. And so, you really kind of got to think about kind of the whole picture.
I mean, I think that's just spot on so much that we have to talk with a lot with our patients about how this isn't a job, what you're doing. You may feel like it, but it's not a job, right? Sex is supposed to be organic, supposed to have that pleasure experience tied to it. So, I think that's what Dr. Halpern says is exactly correct. You got to find, put that back into it, not just make it so much of a job.
Yeah. But still, I think you can still have erectile dysfunction, right? Yeah. And that's kind of what Dr. Halpern was going at. And, we have solutions for that, right? If you come in with erectile dysfunction, we can still treat your erectile dysfunction the same way we treat other men with erectile dysfunction if needed. Sometimes you just need, a little boost, whether it's Cialis or Viagra or something to just kind of help you. There's nothing wrong with using those if it's going to, maybe either put you in a better state of mind, relieve some of that anxiety or stress. Yeah. It works.
Yeah, I mean, we see this so commonly, and Justin, obviously, in your work with us, you see this. We have so many guys who are trying to get pregnant who we have on medications like Viagra and Cialis. And at first glance, when we first bring this up, a lot of guys are a little resistant. They're kind of thinking like, do I really need this? But, the truth is that a lot of guys do. And there's really little harm at all in taking these medications. They do have some side effects. You guys have kind of talked about this in other contexts. The thing that also comes up a lot, which is important for our discussion today, is they do not have any sort of negative impact on fertility. I get a lot of guys who are asking about taking these medications while they're trying. They definitely don't have a negative impact on fertility. So that's just another thing to keep in mind. If you are going through this, don't hesitate to use the medication if you need it.
It's a great point. It's a really good point. So, I mean, just to kind of review there. So every 1 to 2 days while you're ovulating is sufficient. If you want to go more, God bless, but the data really supports, at 1 to 2 days, it's fine. And I know Dr. Ramasamy over in Miami, who we've had on, also usually tells them, sometimes just pick a time and pick a schedule, whether it's every other day. And sometimes, that kind of just allows you to kind of just get it as a routine. Maybe it sometimes can help a little bit more people where you know that you have certain things throughout the day. You're going to block off time so that you can get that done. So it's less rushed. Maybe when like you pee on the thing, you're like, okay, now we have to go. So I know that some people do use that as a guide as well. So, you kind of, we got into the intercourse aspect. We talked about erectile dysfunction, but what about, the lifestyle choices that people can make in their everyday lives that can affect infertility? And I think these are some of the more common questions we get. So I think the first one, which I think is really one of the more important ones, is overweight and being obese. Can being overweight affect your fertility?
Yeah, the short answer to that one is yes. I mean, we know that there's a pretty strong association between being overweight, certainly obese, and infertility. There's probably a bunch of ways that occurs. There are a bunch of mechanisms. through which, we see that those kind of changes and those associations. We know that being overweight and obese can really change your hormone profile. It can mess with your hormones like testosterone and others. It has a lot to do with the endocrine system. And so that's just one of many ways that we think obesity can contribute to kind of infertility, or at least worsening of semen parameters. And in general, being overweight or obese, as we know, and you guys have probably talked about on this podcast, is just bad for your overall health. Now,
yes.
Easier said than done.
Not good for your penis, for sure.
Yeah, bad for your penis, bad for your sperm. And I think, the general rule of thumb in our corner of the universe, whether we're talking about the penis or sperm, is what's good for your body, what's good for your heart is probably good for your penis and your sperm. And I think when it comes to fertility, that really is kind of the cardinal rule. So, everything in moderation. I'm sure we'll talk about things like diet and exercise, in a little bit, because that's a big part of lifestyle as well. But really, if you can take off some weight, that's going to go pretty far. I can think of at least one or two specific guys in our practice who were pretty significantly overweight in the obese category and beyond, and had significant abnormalities on their semen testing, lost a lot of weight. We're talking like 60, 80 pounds, and we saw improvement in those numbers. Now, there's no way to know.
Remarkable.
It's amazing, and kudos to anyone who could take that on and succeed in that way. Now, there's no way to say for sure that one was the cause of the other, but certainly probably played a role. So I think weight is one of the things we really need to try to tackle. But of course, one of the hardest things to tackle when it comes to anything, and infertility is no different.
Right. But the important thing, and I think Kevin is about to say, I think we're reading each other's mind, is this is reversible.
Yeah.
Right? Like, this is absolutely reversible. That is the biggest thing with being overweight and being obese. You can fix it. You just said it yourself. So if you want to talk about things that you can fix in terms of infertility, this is one of them, right, Kev?
Yeah. I mean, I think, we always talk so much about what are things that, not so much that you can control, but like things that you can control. You know what I mean? Like, and this is one of them, right. Your behavioral lifestyles. And so I think this is one of the things that you can try to address. Dr. Halpern, on that note, are there any specific diets that really improve fertility?
There's so many diets, the gluten-free bullshit, some other BS thing like Atkins, Mediterranean, but some of them are legit. But I know you've done some research on this.
Yeah, diets are highly varied. Let's put it that way, Justin. But yeah, there's so much, evidence out there on diets, but it's all pretty crappy. And diets in general are really, really hard to study in medicine. You got to do big trials.
Right.
People have to really stick to diets. You need large numbers of folks in there. And so most of the studies on diet are just crappy. When it comes to infertility, there have been some studies showing that, for example, a lot of red meat is bad, a lot of high-fat dairy is bad, but low-fat dairy is good. There's a lot of stuff out there. Some of it is better than others, but I think nothing is really all that compelling. And so I don't think there's any particular food I would kind of pursue or avoid. I think, the stuff that Justin, alluded to, things like keto diets, Mediterranean, low fat, whatever it is, we don't have great evidence on that, but I think you want to just, do something that's balanced and everything in moderation. So I think, the Mediterranean diet, like we talked about before, what's good for your heart is good for your penis, good for your sperm. I think that's kind of a nice middle of the road way to go. But there's not one thing that I'd say you gotta gravitate towards or stay away from. I think everything in moderation is the golden rule.
Yeah, and I think obviously I think some diets, you heard what I said. I think some of them just don't work. But if it works temporarily, that's great. That's a fad diet. But I think whichever diet really just gets you to lose some weight on a consistent long-term basis is the right diet for you, and as long as it has healthy results.
And just like what Dr. Halpern said, I think it's a key word that we use in all of medicine: moderation. Right? Moderation.
Right.
Moderation
Absolutely.
is. We don't know everything to a T, but I think what we do know is that moderation is beneficial in the overall scheme of things. So,
and I think, Justin's point is a really good one because, we've done some research in this area, as you mentioned, and we've looked at, for example, testosterone levels, which are really important for fertility. And we found that, there's some diets have modest advantages over others when it comes to testosterone levels, but those differences pale in comparison to the difference between being overweight and not overweight. So,
Right.
It's much better that you lose the weight and stay healthy whatever way you can than adhere to a particular type of diet. And so, in the big picture, kind of just being healthy, keeping that weight managed, as long as you're not doing something really crazy, like whatever crash diet Justin's, going on next week, I think you're going to be okay.
It's not a good one. It's a juice cleanse of some sort, I think.
Yeah.
Oh, that's hilarious.
I don't know. Whatever. So, we talk about diets, and now I want to bring up exercise because I think exercise is very interesting because in general, does exercise help? Which I think we can all agree. We just said, if it helps you lose weight and you do it in moderation, yes. But there are extremes, right? Like I always think of like gymnasts and I think about reduced growth. Like, are they doing too much to their bodies? They delay their periods. Can doing something like Peloton every day, or can being a long distance runner, can these other things that maybe are too exhaustive on your body, can it swing both ways? And that's kind of my question. It's I don't know.
Yeah, it can. I mean, we're starting to sound like broken records here, but moderation is the word that comes up again. Obviously, no one's going to argue that exercise isn't good for your body, and everybody should be exercising. We know there's some pretty actually strict guidelines as far as how much exercise you should be doing on a weekly basis, and we've looked at some of this with relation to testosterone and things like that in some of our research. We know that muscle building exercise, so strength training, can increase testosterone, and that's important for fertility. So all that stuff is good. There are some concerns about certain exercises. You mentioned kind of cycling or Peloton and things like that. Probably guys who are doing the kind of pseudo athlete or kind of like amateur professional athlete approach where you are crushing 30 miles a day, 7 days a week, that probably isn't good. There have been a couple studies looking at bicycling in particular because you can imagine bicycling, you're sitting on that seat, your testicles are popping up and down that whole time. It just stands to reason that there might be an issue. The truth is, if you do this somewhat infrequently or you do this 2-3 times a week, it's not going to be a problem. If you're taking those, clocking in 500 miles a week, there is some evidence that some of these real professional athletes who are doing that kind of intense workout, they can kind of have an impact on their semen parameters. And so I think, you really just gotta take it a little bit easy when you do that. You may want to kind of diversify your workout. So if you're doing Peloton 7 times a week, maybe go down to 3, and for the other 3 days a week, try some strength training. That's going to get you some bonus points on your testosterone anyways. Really kind of diversify so that you're not just doing one thing in a kind of a supercharged kind of way. That's
another great word out there. Diversify, right? Diversify, change it up. Don't do the same thing over and over. On that note of, just for my own sake, on the note of, cycling shorts, can tight clothing affect your fertility? Boxer briefs, tighty.
The tale as old as time, right? Like, am I wearing tighty whities? Yeah. I mean, I don't wear tighty whities. I wear my boxer briefs guy.
Whatever you say, Justin. Whatever you say.
But does wearing tighty whities versus boxers, it's a common question we do get asked.
Yeah, I'd say that's actually one of the most common questions we get asked.
Yeah.
And there is a little bit to it. So, the basic idea behind all this is, the testicles basically like to be cool. They like to be cooler than the rest of the body. That's why they're hanging down in the scrotum. That's why kind of we're made that way. We're not sure exactly why they like to be cooler, but being cooler is important for making sperm. And so you can imagine as the testicles kind of get closer to the body, a little bit closer to that kind of core body temperature, it can cause heat to go up in the testicles, and that may cause an issue with sperm production. And there are actually a couple studies showing that may be the case. There have been some really old studies dating back over 25 years ago in some of the best medical journals. There have been a couple newer studies showing that there may be modest differences in guys who are wearing super duper tight underwear. But, what I usually tell patients is, as long as you're not wearing, some sort of Speedo situation, you're probably going to be okay. It's probably not going to be the difference maker. But the truth is that there is some evidence to suggest that maybe there's something there. So do I think that this is going to be the thing that puts you over the edge one way or the other? I don't. So probably just want your balls to be comfortable however you're comfortable. But
balls
if you're
being comfortable. Love it.
If you're trying to check every single box, then you probably don't want to wear something super duper tight all the time.
I agree. I mean, like it's probably is not going to make the difference, but like you said, but if someone's interested, it can't hurt to, maybe loosen it a little bit up with some boxer briefs or boxers for sure. Now you mentioned the temperature, which is very, very important, right? So as you said, your balls are in your scrotum, and your scrotum has a muscle that can bring your balls up closer to your body when it's cold, and it can also loosen and get further away from your body when it's hot. And I'm sure people have noticed that happens, pools, etc., which leads to the next question. This change in body temperature, which you alluded to, can potentially be affected, or testicular temperature that can be affected by your underwear. Can there other things like a hot tub cause infertility problems, because you're sitting in there and you're literally increasing the whole temperature of your body as well as your balls? So can that compromise fertility?
Yeah, absolutely is the bottom line. I mean, the evidence on this one also not great. So only 1 or 2 studies have really looked at this, but those studies were somewhat compelling. I mean, basically you have guys who are using hot tub sauna steam rooms. They're basically immersing their balls in that heat, and it's going to take a toll. And so this is one of those things that I think, is kind of easy to do and easy to stay away from. So, when it comes to lifestyle, there are certain things that are just tougher than others. This is not one of those things. So I actually do mention this to all guys who come in and say, look, maybe you're a guy who likes to, hit the sauna 3 times a week after the gym. Maybe you're going on vacation. Yes, that's great. It's good for the body. It feels great. But, for this short period of time, just cut that out, because it may be okay. It's not a guarantee that it's going to cause you trouble, but it's possible that it could cause you trouble. And why take that risk? Even getting a fever. So if you get sick, you get the flu. If your whole body temperature goes up from the fever, and we'll probably talk about this in relation to COVID, but if you get a fever, that in and of itself probably can impact your semen parameters. And there's been a couple good studies looking at that. And so obviously you can't live your life, avoiding fevers, because that kind of hits you out of nowhere to some extent. But you can manage not to sit in a hot tub or a sauna. So I think this one's important, even if the evidence isn't great. It's just too easy to get right,
Right.
Let's talk about that though. So, topic of our times: can COVID and the COVID vaccine affect your fertility?
Yeah, so obviously a lot of the work on this topic has been done, by your mentor Kevin, Dr. Ramasamy, down at the University of Miami, good friend and colleague of ours as well. There's some really reassuring evidence out there, and there's some pretty concerning evidence out there. So I'll start with the latter. I mean, COVID is just not good for all sorts of organ systems. It's not good for your body in all sorts of ways. And the GU tract is no different. We just know that COVID can wreak havoc in a lot of different ways. There's some pretty good evidence COVID can cause issues with sperm parameters. COVID can cause issues with inflammation in the testicle. We know that COVID causes high fevers, which may be one of the reasons that happens. Erectile dysfunction, another thing that we've touched on a little bit, not the main topic here, but some emerging evidence that is probably associated with COVID infection. So the bottom line is COVID infection is nasty in all sorts of ways. And, your penis and your balls are no different. And so that kind of brings us to the vaccine, which is to say, hey, if we can do something that might prevent us from getting infection or dampen the severity of that infection, we should probably do it. But of course, these vaccines are new and everybody has had concerns. Hey, is this safe for fertility? Is this safe in all sorts of ways? Dr. Ramasamy's group really has done us a big favor in studying this in a rigorous way. So, really, high impactful paper in the Journal of the American Medical Association, JAMA, really kind of one of our most important journals, showing that men, basically did not see any negative changes in their semen parameters before and after receiving the COVID vaccine. And I think this was really, really important because, yeah, this is the disease of our time. There's a lot of uncertainty out there, but I say with, true certainty, based on that evidence, we just do not see a negative impact on fertility. And so I'm telling all my guys to get vaccinated, because the last thing I want to see is guys who have normal fertility or have normal semen parameters come back and see me 3 months from now and say, hey, I got Omicron, I got this high fever, and all of a sudden we're seeing these semen parameters go down. So I just don't want to see that happen. And I would recommend all guys out there get vaccinated for all sorts of reasons.
Excellent points. And I do want to, you do mention the 3 months, and I think it's important for all of the things that we're talking about, a lot of these lifestyle changes, there is a turnover is about 3 months. Any infection, we don't know the long-term potential effects of COVID infection and infertility. The data is still out there because, it's still relatively new. And so we don't have the long-term effects. You did say 3 months, and we hope that you recover your semen parameters, but it's the same thing with the hot tub, the saunas. And why 3 months? It's because it takes about 74 days for spermatogenesis and sperm to form in your testicles. So, if you said like, oh crap, like I came to you, you come to my office, or you come to Kevin's office, or you come to Dr. Halpern's office, and you say, I just was in, I was in the Iceland and I was in the hot tubs for the last week. Or I was in like, wherever I was just at the gym. I was at the gym with my buddy at the sauna last time. And we were just there, and we were in there for the last 3 days. And he was like, oh, I got to tell my girlfriend, like we were thinking about going family planning. So, these are all issues that, it's fine for a temporary thing, but every time, in about 3 months from now, you're going to have hopefully another shot, but there is a time frame, a lag in time for you to recover. So, it's one of those things.
Yeah, I think that's a great point. Just understanding that, the process of sperm going from A to Z, from basically being born until they're mature takes, about 3 months. And so anytime we see a negative insult to sperm production, it's going to take about 3 months to recover from that. And anytime we do something that we think is going to boost up sperm production, it takes us about 3 months to see,
Right.
A result of that kind of treatment. And so this is a little bit of a long game sometimes when it comes to kind of sperm and male fertility, something that I think we got to keep in mind as we talk about this a little bit more.
Yeah, I think that's also like an important point, because when you're going through this whole infertility process, you start feeling like you're going against a race against time. Each month that's going by, you're getting, the female's getting older, things are, different milestones are being passed. So, if this is something you're thinking about, you should make these changes, as soon as possible during this time frame that you're thinking of having a child. So Dr. Halpern, on that note, a lot of patients ask me, can drinking alcohol affect male fertility?
Yeah, there's actually good news on this one, which is that you really have to drink a lot and drink pretty hard to see an impact on male fertility. So, when it comes to alcohol, we know that the guys who tend to have the biggest problem are the chronic alcohol abusers, the guys who are binge drinking, the guys who have liver dysfunction from their alcohol use. That's really where you get into trouble. A drink a night, couple drinks, that's probably not going to cause too much trouble. Again, everything we got to take with a grain of salt when it comes to things like alcohol, smoking, a diet, all these things, because they're notoriously hard to study. And so the evidence on this isn't good. There are certain things that I think we err on the side of caution and say, hey, better just stay away from this one, like the hot tubs and the saunas, because the evidence is good enough and it's an easy enough thing to do. We try very hard not to be the ultimate buzzkill when we meet these guys. And so there are certain things that actually are okay, and alcohol is actually one of them. And so, there are other things where I am kind of the buzzkill, but this one, I think most guys are in pretty good shape unless they're drinking pretty heavily. And I have had a couple guys who were, had real alcohol abuse problems, and that did impact their fertility. And you as the infertility doctor sometimes can be the first person to help them find treatment for that and make a big difference in their life in a lot of other ways. It's not common in my practice, but it's definitely happened a handful of times.
It's an excellent point. And it's an excellent point about, I always feel like somewhat sometimes we're like narcs or something. Like sometimes they don't want to like tell us. It's like we have to ask about these things because it can potentially cause an issue with you. And that leads to the next question is, you know, we talked about alcohol. What about cigarettes and vaping? Can those affect fertility?
Yeah, so vaping is way too new for us to really have an understanding. The evidence on that is just not there yet. It's such a sea change from where we were 10 years ago that we just don't know. Smoking, a little bit better evidence, probably does do some harm to sperm parameters. I tell guys, again, smoking is one of those things we should try to get rid of, and not just for fertility, but obviously smoking, like obesity. These are probably the two worst things you can do for your health, is being overweight and being a smoker.
Right.
So it's also, again, a great opportunity for us to be complete doctors, not just infertility doctors. You know, as I mentioned before, a lot of young guys who are coming in to see us don't have a primary care doctor. They've not had a chance for somebody to talk to them and say, hey, smoking is bad for your health, and to potentially direct them to the resources that's going to help them with that. So I usually use this as a teaching moment, not just when it comes to fertility, but to say, hey, maybe this is a wake-up call to think about, you know, kind of getting rid of smoking, and let me help you figure that out. So I think, you know, I think smoking is one of those things that that probably is worth cutting out based on the evidence that's out there. You know, vaping, I think, is really just a black box at this point.
So here's a question that I know me and Justin, we talk about all the time. It's, you know, supplements that are out there, and, you know, they state that they can improve fertility. So what does the data show about supplements and fertility? And are there any specific ones that you recommend?
So this is one of the areas where we actually do have some really good evidence when it comes to a lifestyle intervention or some sort of non-pharmacologic intervention. For many, many years, we didn't. There are a lot of studies out there looking at all sorts of different things. Every vitamin you can think of, zinc, folate, vitamin A through Z, and all sorts of other stuff. And they mostly have mixed, you know, kind of mixed results out there. But in the last couple of years, we had two really, really good trials looking at some of the important supplements that had been used very regularly. These were zinc, folate, and then kind of this composite vitamin, which was consisted of a bunch of different supplements put together. And what those two studies found is that they actually didn't really make any difference when it came to getting pregnant or even changing semen parameters. Now, you know, those studies weren't perfect. Even really good studies are not perfect. And when you read a study, you got to think about not just what it says in the conclusion, but, you know, is the patient in the study similar to the guy that I have, you know, in front of me in the office? So, you know, I think we need to think about that in a little bit more of a nuanced way. But yeah, in general, the evidence does not really support supplements, and the new guidelines from, you know, the Infertility Society and the American Urological Association kind of reflect that, to suggest that really we don't have great evidence. Now, the flip side is, you know, a lot of guys will say, well, what's the harm? And most of the time there really isn't. Some of these studies have shown that maybe there's a chance of getting some more kind of gastrointestinal side effects if you take these medications. So, you know, if you take these supplements and you start to feel, you know, that you're having side effects, definitely stop those. And then the other thing is sometimes there's stuff in these supplements that we just don't understand or that guys are not aware of. You know, supplements is kind of this wild, wild west when it comes to regulation. It's not governed in the same way we know that medications are. And so the thing that you really worry about is that there's something in that kind of supplement that's got 100 different ingredients in there that might actually have a negative impact. And, you know, there are a lot of plant-based supplements that can have an impact on hormone levels in a negative way when it comes to fertility. And so I get really wary of guys who are coming in with a picture of a supplement that's got 100 ingredients on the bottle. They want me to look at each one. I think, you know, when in doubt, just kind of leave it out, so to speak. But the one thing I think does make sense is at the very least a multivitamin, right? You don't want to be deficient in anything, so you want to get that kind of, you know, that men's one a day, Centrum, you know, whatever it is. That's just going to get you everything you need. That's usually what I tell my patients.
It's an excellent point. And I think a lot of those supplements, like you said, they have things that are very potentially bad for your fertility as well, which, you know, there's a lot of these things. We've seen patients, they come in, they say, hey, I'm on this testosterone fertility boosting supplement. And you read it and there's like concern. Like sometimes I think there's been studies where they put legitimate testosterone in these supplements. And which kind of leads to the next question, right? Because when you think about, guys getting more energy, getting stronger, we think about testosterone. You want to be yoked. We talk about going to the gym. We talk about eating healthy. So naturally, guys would think, all right, let me get some testosterone. Let me just take some tea, and it'll probably help me out in this department as well. I don't think that is the case. However, I think we know that's not the case. So can taking testosterone affect your fertility, Dr. Halpern?
Yeah. So, if guys are out here listening to this podcast, if you remember nothing else from today, the most important thing you can learn from our kind of podcast today is that taking testosterone is bad for your fertility. And the thing is that this one is really confusing, because we've just spent a lot of time talking about, kind of obesity and its effect on testosterone and why we want to get testosterone levels up. And the truth is, we do want your testosterone levels to be higher. That is good for fertility. If testosterone levels are low, that's bad for fertility. But there's a real nuance here, and it's got to be testosterone that your body is making. Because what happens is that if you take testosterone in a pill form, in an injection, in a gel, from that kind of sketchy dude at your local gym, whatever the case may be,
Justin,
all right?
No, His name is Frank. His name is Frank. He's a good guy. He's a good guy.
Justin tried to introduce me to Frank once, and I just wouldn't have it. I got my own guy. No, but we see so many guys coming in who have a Frank, right? And and what happens is that when you take testosterone in that way, it's basically telling your brain that, hey, we're good. We got enough testosterone in the body. What happens is that actually shut down your body's own production of testosterone in the testicle. And you need super high levels of testosterone in the testicle in order to make sperm. So it turns out that the testicle has about 100 times higher level of testosterone than you have in your bloodstream. So, if you're taking testosterone in a shot, your testosterone level in the bloodstream may be okay. But if it's shutting down your testicles' production of testosterone, you are up the creek. And we have seen so many guys, we all know this, people in our field are really aware of this, but most guys just aren't. Guys taking testosterone, their sperm counts don't just get low, they go to zero. Okay, and this is such a strong effect that testosterone has actually been looked at as a male contraceptive agent. There have literally been medical trials that have studied testosterone as male birth control. That's how bad this is for your fertility. So, if there's any take home from our discussion, you do not want to be taking testosterone if you're thinking about getting pregnant. Now, there's all sorts of other stuff that we can give guys to improve their body's own production of testosterone. That's good for fertility and for their testosterone. So these are kind of like win-wins and killing two birds with one stone. We may get into that later today, but you do not want to be taking testosterone. And certainly, if somebody's trying to give you testosterone, you want to think long and hard and ask them these questions before you go forward.
Yeah, and I think the other important thing is, if you're interested in getting testosterone, guess who can give you guys testosterone if it's indicated, of course, and who can have that conversation about the risks and benefits of testosterone? The people that are talking right now, right? So, you don't need to go to Frank. I'm trying to put
Frank could be a good guy.
Unfortunately.
But
he's a nice guy. He's a nice guy. But, so it's important, if you ever think about taking testosterone in any capacity, whether you talk with a doctor first, okay? Because clearly there's implications.
And that's why we're trying to get this message out now, hopefully for our listeners, before they even use testosterone. Because me, Justin, Dr. Halpern, we've seen it. We've sat across a patient who's been on testosterone, and we have to review their semen analysis with them, and they got zero sperm in their ejaculate, and they're trying to conceive, there is a pathway.
And they've got no idea. Nobody told them. They had no clue. And sometimes, guys are getting this stuff, we're joking around. Sure, a lot of guys are getting this stuff illicitly at the gym. A lot of guys are getting this from doctors. They're getting this from doctors who are prescribing this to them. They're not being counseled appropriately. So just because you're getting this from a doctor doesn't mean that it's the right thing for you. It doesn't mean that you're getting the right information. And we've had countless guys, like Kevin is saying, who are sitting across the table from us, their face is ashen. They're like, how come nobody told me this? I had no idea. And it's a tricky situation.
For sure.
So
I know that there's, we talked about some medication supplements. what other medications should men be conscious of that can potentially affect their fertility in a bad way? I mean, we'll talk about medications that can improve fertility and increase your testosterone. I think that's another day and another topic, because it's a long conversation. But are there any meds that guys should just kind of think about before, even walking into the office or when they're talking with their other doctors, that could be concerning if they're family planning?
Yeah, there are a lot of medications that can have a direct impact on sperm. Certainly, if you've got a very, kind of specific or, a somewhat uncommon medical condition, you're taking medication for that, really check in with your doctor, your specialist, to find out if that particular medication can cause trouble. Certainly, we know chemotherapy, if God forbid you need cancer treatment or something like that, that obviously is a totally different ballgame. I'd say in young guys who we see all the time coming in for fertility, there's a couple medications that we get asked about a lot. Certainly, we already talked about like the Viagra, Cialis. Those are totally fine, no problem at all. We get a lot of questions about serotonin reuptake inhibitors, so SSRIs, that a lot of guys take for depression and anxiety. The evidence on that is kind of mixed, but those are probably safe. Our group actually has some research coming out on this. Those probably are okay. The one that I think is pretty controversial, and one that I do see a decent amount of, is finasteride. So guys who are taking Propecia for hair loss. There is some compelling evidence that can have an impact on sperm parameters. I think, everyone's approach to this is differently. One of my mentors and somebody that I look up to quite a bit really does not ask guys to stop that medication if they're on it when they're trying to achieve a pregnancy. I actually think the research is somewhat compelling, and I do tell guys to stop that if they're trying to get pregnant. That's another common medication in kind of young guys who are trying to get pregnant. Other than that, I think, just generally be safe. If you're starting to think about attempting to conceive, just get ahead of it. Ask your doctor, whoever's prescribing that medication, say, hey, just FYI, we're probably going to start trying the next 3 months. I've been taking this thing for a long time. Is there any reason I need to stop this? And if there's any question, then, have them refer you to someone like us who can kind of really kind of peel the layers off and get to the bottom of it.
I think that's spot on. At the end of the day, if you have any questions, ask your doctor, ask the infertility specialist. We can help you out. Dr. Halpern, these are all great points. I think the last thing that we wanted just to ask you about in terms of related to lifestyle and maybe the patient population around this age is use of marijuana. Does it cause infertility?
Especially now, it is legal in many states. People are using it more frequently, more commonly, whether it's edibles, smoking. Yeah. There's a lot of different, thoughts on this, there's data now support with research on this, and it's a very, very common question that we get asked, especially living in Illinois, where it is now legal in Chicago. So, can marijuana affect your fertility?
Yeah. So for a long, long time, the research on this was pretty terrible, and that's probably for a number of reasons. I mean, first of all, you're talking about an illegal substance. So if I ask Justin if he used something illegal, he's not gonna be honest with me. In fact, he's never honest with me, but he's definitely not gonna be honest with me when I ask him, if he did something, illegal. So when you're doing a study, obviously, if a drug is illegal, you can't randomize folks to taking an illegal drug versus not getting one. So, we never had that study. And, if you ask somebody, hey, by the way, how much of this illegal thing are you using? They're not going to be honest with you. And, they quite honestly, they may not remember very well, because if you ask them.
And you can't quantify
that's
it.
Right.
We can't even quantify it. Right?
That's right. And even now, I mean, kind of, as you mentioned, Justin, just the different ways of kind of taking marijuana, edibles, vaping, all these different kind of methods of administration. We're getting better. Like, I think when it comes to edibles, for example, there's a lot of precision in the dosing. But in general, for a lot of the studies that are out there, we really don't know the dosing, right? So if you ask somebody, hey, how many times you used marijuana in the last week, if you use it once, it's not the same as if Kevin uses it once, depending on what you did, how much, THC you got and all that. So the evidence is still not great. Having said that, the evidence is starting to mount that it probably is not good for fertility. Now, we don't know definitively how bad it is, so to speak. We don't know if edibles are better than smoking. That's probably the the question I get the most. I definitely see a lot of guys who are using marijuana, but a lot of them will say, hey, I just take an edible in the evening. Is edible the same as bad as kind of vaping or smoking? And we just don't know the answer yet. There's some folks who are trying to answer those questions and figure that out with some good research, but I think the jury's still out on that one. I think this is one of those areas where, it's kind of the buzzkill meets sensibility, right? So what I tell guys when it comes to this kind of thing is, look, I mean, if you want to do every single thing you can to improve your fertility and you want to leave no stone left unturned, then I think cutting this out is probably a good thing. Having said that, if this is a big part of your quality of life and it's something you don't want to give up, and we do a semen test on you and it looks pretty reasonable, I think it's a very reasonable decision for guys to keep using this. And the same would go for something like finasteride. I mean, I see a lot of guys who say, hey, I've been on this for 10 years, really important to me. It's helping me with my hair. I don't want to go off of it. And I say, look, this is a choose your own adventure. You get to decide kind of how you want to play this. I can just tell you kind of what the evidence shows, that maybe if you stop this, your numbers might get better, but ultimately it's your life and you got to make the call. And I think marijuana, that's the same way I approach the kind of the marijuana question.
It's so interesting because I've seen multiple guys where, lifestyle really has impacted their parameters. I've seen guys who are actually fairly skinny who legitimately, go to a sauna every day and smoke weed every day. And we told them, hey, listen, if this, your numbers are low, stop these things. They come back 3-6 months later and it's normal. I mean, does it move the needle, like you're saying, for every single person? You can't say, probably not. But there are some people where a cumulative effort of things that they do, whether they're overweight, they're smoking weed every day, they're smoking cigs, they're not exercising, it's gonna add up. But to what degree? I mean, it's hard to say until you kind of stop it and we see what happens.
Yeah, I mean, I think a nuanced approach is really important for these things, and I think sometimes the way that I'll approach it with guys is, well, let's see what your semen test shows, right? If there's something that's really abnormal there, like that guy who's got very, very low counts and is in the sauna every day and smoking weed every day, okay, we got to make some changes. I think that the tricky place is where we get into guys who are using some of these things, who have some of these exposures, and their numbers come back, quote, in the normal range. Now, we might get into this, but a semen test is a good test, but it's not a perfect test. It's not the only test to tell us about your fertility. There can be negative impacts on fertility that don't show up in a semen test, and so that's kind of where we get into that gray zone of the guy who's got like a totally normal semen test, saying, well, look, I'm in the sun every day, but check out these numbers. I'm crushing it. And then the question becomes, well, where do we draw that line, and how do we kind of come up with some sort of nuanced approach?
No, I agree. And that's where the art of medicine and the patient-doctor relationship really comes into play.
Yep.
And what may work for you may not work for another person. Right. And that's what we're here for, to, talk with you and figure that out. Because obviously fertility is an important part, but your total health, your mental health, your relationship health, these all play important roles. And as you can see from the conversation we've had in this last, hour or so, we do consider all of these things when you're talking about fertility, when you're talking about family planning. So yeah, it's a great conversation, and we're going to do a male workup for infertility talk.
Still lots to
separately.
Talk about. Still lots to talk.
There's a lot of stuff to talk about, and with regards to male fertility, male infertility. Right. But I think that today what we learned from you was really important, kind of like bare, background information that I think people at home almost some things, without even seeing a doctor now, hopefully that they can start learning about or start planning before they come to see a doctor. But I think the point here is, if you're starting to, have issues or you're concerned about family planning, it's been a year, or if you're just interested in seeing your fertility status, it is important to go talk to your doctor and see how we can help, and if you need any help. So yeah, I want to thank you again, Dr. Halpern. This was awesome. We really learned a lot. I hope our listeners, and I think they learned a lot. Any comments by you, Kevin?
No, Dr. Halpern, thank you for coming on. You've got a way with words. I've learned ways to counsel my patients now. The way you just got a way, So thank you for coming on. And we're definitely going to have you on future episodes. You're just fond of knowledge, so great to have you on.
Yeah, absolutely.
Well, thanks for having me. Obviously, what you guys are doing for men out there and, for our corner of the universe is awesome. The whole idea here, we started with this, and I think we'll finish with this, is just getting the word out, right? I mean, the word is that male infertility is more common than you think. A lot of guys are struggling with this, and, go get the help that you need. There are specialists like us, but there are places you can start before that, your doctor, some good online resources. So go check that stuff out. I look forward to coming back on here. You guys are awesome. Thanks for having me.
Awesome. All right, guys. So thanks for listening to Man Up. As always, feel free to review, comment, give us a download, subscribe, 5 stars. I now know Spotify is doing reviews, so you can do 5-star reviews on Spotify, on our iTunes is also always appreciated. You can find us on YouTube. You can watch our videos and episodes there. You can also find us on TikTok, Instagram, and Twitter. And if any questions, comments, concerns, feel free to reach out to Kevin or I via our social media as well. For Kevin and Dr. Halpern, thanks for listening. Until next time, have a good one.